So speaking of dentures and partials, we've had a lot of patients in our office who, as they're leaving with their new denture or partial denture, will look so excited and say, "I'm going to go have steak tonight." I wanted to ask because maybe sometimes they do ask, should patients avoid certain foods after different procedures that we do in our office, and if so, how long should they avoid those foods?
Yes, it's so hard as a provider sometimes to kind of temper the patient's expectations. A lot of them have been without teeth for a super long time. They're so excited to get their teeth, and they're like, I just can't wait to go eat my steak. You can't start out with a steak as your first meal with your dentures. Well, I should say,
Barbecue chicken?
you may have one patient here or there. I did have a patient who somehow he went right away and ate peanuts with his dentures, but typically that's not the case. We always say to start off with something soft. Once you can tolerate something soft, then definitely work your way up. It's reasonable to think that you'll be able to eat just about anything with your dentures if you work up to that. And like I said, there's a range. Some patients can eat peanuts. Some may have a little bit more of an issue. And if you wanted to talk about other procedures where you're wondering about avoiding certain foods after the procedure, we say any procedure that you receive local anesthetic that's saying that we numb you, you're going to want to wait to eat till after the numbness wears off, just so you don't bite your lip or your cheek or anything that may be numb. We also say don't have anything hot, just because if you're numb, you might not be able to feel how hot it is, and we don't want you to burn your mouth. There's patients who are like, well, I didn't eat yet today. I'm really hungry. If you cannot wait, we always say like yogurt or a milkshake, something soft.
That's a victory anyhow, right?
Yes, right. Other procedures, let's talk about. So if you receive a fluoride treatment at our office, we do two different types. One is like a gel. With that, you don't want to eat or drink anything for 30 minutes. After 30 minutes, then you're free to eat or drink normally. We also offer a varnish. With the varnish, you can eat right away. It'll feel kind of sticky on your teeth, but that's a good thing. That means that fluoride is kind of soaking into your enamel. For the first 4 hours, I would say nothing kind of too hot or crunchy that could kind of wipe it off. But after the 4 hours, you can even brush it off if it kind of feels too sticky for you, because after 4 hours, you've had most of the uptake of that fluoride. Another procedure that kind of came to mind with this question was whitening. Patients ask, how long is this whitening going to last? How can I make it last longer? So our hygienist, one of our great hygienists, she always says, anything that will stain a white t-shirt is going to stain your teeth. So it's up to you really what you want. You can eat and drink whatever you like, but for the whitening to last longer, we say like red wine will stain your teeth. Coffee is another big one, which I know people think it sounds weird, but drink your coffee through a straw. Even hot coffee, you can drink it through a straw, and that way it'll bypass kind of the fronts of your teeth, kind of prevent that staining from occurring. So smoking, that's going to stain your teeth again. So plus it's not good for you, so don't want to do that. And those are kind of the big procedures that came to mind about when you want to watch certain foods.
Got it. That makes sense.